All right, my name's Jackie Sump. I know most of you, I think, from the K-State Peak team, and it's my pleasure today to introduce your next speaker. Over the past 30 years, Migette's career spanned both practice in the architectural interior design profession, as well as higher education and research. Much of her work focuses on projects that address the needs of older adults, especially those who lived in planned care settings. This specialization has fostered her research agenda, supported by grants and other sponsored funding. As an educator, her broad range of experiences has afforded her the opportunity to contribute to continuing education programs for professionals in the fields of design and long-term care. So now, presenting Integrating Enhanced Barrier Precautions in Person-Centered Care Homes, Keeping the PCC in EBP, is Migette Kaup.
Thank you, Jackie. I've got a mic on. So can everybody hear me okay? We are Zoom recording this, so I want to make sure that the quality for the recording is pretty good. So if you can't hear something or need something repeated, just throw your hand up. It's my pleasure to be here with you today. I am also on the PEAK team. I'm one of the co-PIs of the PEAK program. And in my role, I'm looking at the evidence that we are able to establish regarding the impacts and outcomes of person-centered care practices. And as Jackie noted, my background is in the built environment. So I look at the environment as the medicine, if you will. It's the therapy. It's the backdrop that we create around people, that is residents, staff, guests, visitors, families, that empower people to do what they want, as much as they want, for as long as they want. And obviously, we all know here that it takes a combination of the built environment, the policies, our organizational culture to make all of that happen. But today, what we're going to focus on is a new guideline that's coming down, and the enhanced barrier precautions mandates are going to have some big impacts on how you do what you do, but also how you use your environment. And so we're going to focus today quite a bit on the role of the environment and your strategic planning, how you think about implementing these guidelines and requirements within the context of your person-centered care practices and your home. And so the objectives today, we're going to define some terms. We're going to bust some myths about EBP. We're going to focus on thinking about this within the total system of care, because that's what it's going to take. And we're going to look at some problem-solving strategies, because the answers for how you do this are probably going to be somewhat unique and directed by your home's existing resources and the number of residents that you are working with protocols. So the first thing that want to just set the ground rules. Yeah, this is a little disruptive, but our goal is to, one, not panic, and two, not overreact. I've heard some scary stories about people who've presented on this topic and have fielded spears. So no spears, okay? I'm just the messenger. And we're gonna kind of try to boil this down into practical things that we can do. So first, let's get our terminology, make sure that if we use acronyms, we know what we're talking about. So the Enhanced Barrier Precautions has been termed EBP. This is an infection control intervention designed to reduce the transmission of multi-drug resistant organisms. And so if you see MDROs, that's what we're talking about, germs. And in nursing homes, and it involves gown and glove use during high contact resident care activities for residents known to be colonized or infected with MDROs, as well as those at increased risk of the acquisition of an MDRO. And so, again, it's not all residents, but we're going to look at some data that helps us kind of think about the scope and scale of what this entails. Now, this is different than your contact procedures that require gown and glove just to walk in the room. We're not talking about that. Okay, so enhanced barrier precautions require gown and glove for high contact resident care activities. And again, all of the information out there comes with tons of disclaimers and tons of conditional statements. And so again, it's important to recognize that you need to look closely at the situation for the resident because some activities may require more than gown and glove. They may also require face mask and or eye protection as well. But what we're focused on here is infection control. That's the bottom line. That's the message that I'm getting. And I will also tell you that in effort to kind of get my arms around what this is going to mean for the built environment, I contacted my person at CDC. And I also spoke with some other folks who are working in infection control to get a sense of what is the priority here? What are the big drivers of this? And obviously, the transmission of infection between residents and between residents and staff is primarily their concern. So I know that Brenda Davis gave a presentation recently at another meeting and provided some information, and she graciously shared her slide deck with me as well. And because this is really important, and I wanted to have a sense of, okay, when surveyors come in, what is it that they're going to evaluate our homes and our providers on? And so these were some of the big points. That residents designated as EBP should have signage indicating such. And we're going to talk about what that means. That staff know how and why the designation of EBP is made and what that includes on their part. So again, understanding each resident's individual care plan needs, that they observe staff to make PPE readily accessible. They observe staff to make sure that alcohol-based hand rub, ABHRs, and I will confess, that acronym was used without any definition, and it took me a while to find out what an ABHR was. And so in case you've never seen that acronym, I hadn't. That's what that means. So your hand sani is not only readily accessible, but it's also used. That they may interview staff to make sure that staff know which residents are on EBP protocols and that they know what that means as they provide care. So these are kind of the outlying ground rules that have been shared with regard to what surveyors say they have interest in seeing. Now, my first inclination, in fact, this was my first big question, was how big is this problem, right? What is the scope of the number of residents we could be managing? Because it has huge implications for how you make decisions about where you put stuff and why. And so, again, this was also shared with some of the data, the citation there, this isn't my data, it is from actually CMS, that we could be looking at a lot of residents who are colonized or are at risk to be colonized. And so it's important that the first step in your strategic planning is to get a handle on how many residents and where are they in our building, because that will then trigger a series of decision-making steps that will help you understand what the best course of action regarding storage and kind of maybe staff roles that happen to kind of fall into play. So you're going to see this over and over again, that documentation is going to be really important in this process because you're going to want to be able to justify your approach. Okay, so the first thing is scope and scale. If we've got a lot of residents, that could mean a lot of different things for your planning. First myth buster. We're a person-centered care home. My resident says, hey, I don't want EBP. It's okay, I'll take the risk. You don't have to do that in my room or for me. We're not going to be able to go down that route because it's not just about them. We have to also consider that part of this concern is the transmission of an MDRO to another resident. There's also concern that you as staff are at risk and that you walk out of that building and you interact with the people that you love and that they could be exposed to a resistant organism that makes them sick. And so we do need to recognize that there's a larger circle of care here that the folks in infection control are, they've got their eyes on. And that's one of the reasons this becomes a little complicated. So it's also important to remember that not every interaction requires PPE. It's going to be those activities where the transmission of fluids is likely to adhere to another surface, be transmitted from the resident to a staff's clothing and their skin, but that there could be that transmission piece that could carry on. But one of the things to bear in mind is that it doesn't mean that every time you walk in the room, you have to gown up. You do not, unless that resident absolutely is in isolation. So we're going to focus on the built environment. So we're going to talk today a little bit about environmental services, signage, and storage. And then we should have time at the end. But I hope we can kind of do a Q&A. We can talk through some strategies. If you want to bounce some ideas, we can talk about some problem-solving methods. Okay, so the first item, and again, you can see that this information is pulled from the CMS's or the CDC's actually frequently asked questions. I highlighted the items that are specific to the environment or environmental service providers. And one of the first things that you do have to recognize is that changing linens is considered a high contact activity. And so those individuals who are stripping bed sheets and coming into contact with the textiles that may have body fluids on them, they're expected to gown and glove up. And so this here is the gown and glove used by your environmental services professionals should be based on facility policy and or for anticipated exposures. In general, they are expecting that action and activity to be subject to EBP protocols. The second item that this was, I will confess, the first time I saw this sign took my breath away, thinking about our person-centered care homes. And my first inclination was, wow, isn't that a HIPAA violation? We're posting information on a door. And so I went to the frequently asked questions, and their position is that it's not in violation of HIPAA. So I didn't win there. But I was also like, okay, how can we address this requirement? Because having signage is a requirement. Okay, how can we address it and not create that sort of, you know, image? Okay, because if we're drawing attention to a resident's condition that doesn't feel very person-centered to me, I wouldn't want to live behind that door. If I had a family member who lived in a home, and that was the first thing that I was seeing coming down the hallway was a big, you know, sign on the door. And then let's look at the statistics. If we have over 50% of our residents who have EBP protocols, what is our hallway going to look like? And what sort of message does that send about our home? Okay. I think that there's a better way to do this. And there are other homes that are doing it effectively. So I'm confident that strategies are available. Symbols can also have meaning that you assign. So here's just one quick idea. create a nice symbol. All right. So I went to AI and I went to those auto-generated systems and I said, develop an image of a flower with a butterfly on it. Bam, got a little image. I went to a variety of companies that do magnets and vinyl decals, stuff that's easy to reposition and move so you don't end up with, tape on your doors, right? And cheap and easy. There are magnet companies that will make little magnets that if your door frames are magnetic, which most of your door frames are magnetic, you can create your own little magnet that has a symbol. If you have smooth walls or you want to use like the vinyl decals that also they stick, but they peel off and they don't leave residue and they don't destroy your paint system. These companies that I found, they'll do like 50 magnets for, like $60. Okay. That's feasible. That's affordable. So you can develop a policy that documents what the symbol means, train your staff so that they know what the symbol means, and you can come up with something that allows your staff to walk up to a door, see the symbol, and know, okay, this is what I have to do when I go into this room and do these procedures. It's going to be important, however, that you have a written policy. Okay, so you need to articulate that whatever your symbol is, it equals this. Okay, all of your staff need to know what that means. Okay, so you need training. Okay, they need to have the training to follow the procedures, and they must be able to communicate to a surveyor. Okay, if I see this, then I know here's what I do. Okay, and it should mean all of the same things that the CDC sign stands for. Okay, this approach has been used in other skilled nursing homes, and so far no one has balked that does not serve the purpose. Okay, so again, what we're trying to do is create a more person-centered approach to the signage requirement. So instead of this, you have, a little decal that sends a nice message. You need to make sure that you effectively communicate to your residents and resident families, why the protocols are in place, what the symbol, the sign means. And of course, you need to make sure that your policy is consistent and something that someone can actually go and reference. Excuse me. PPE storage and disposal. Again, how do we think about the use of our environment? Okay, so where should the PPE be located? There is a couple of challenges with this. I couldn't get anybody to give me a very definitive response to what do you mean by readily accessible? And there are differing opinions about where PPE can or cannot be stored. Okay, so here again is where we need to think about what are the concerns that the surveyors or the regulators might have, and then how do you make the appropriate decision-making process to acknowledge their concerns and express to them or share with them how you have decided and why you've decided what to do. So the other thing that is going to be really paramount here is that all of your homes have different layouts with regard to storage in the hallway. Some of you have niches in your hallway, some of you don't, right? Some of you have great little cabinets located along a hallway that are dispersed nicely. Some of you don't. And some of you have all private rooms. Some of you don't. And so the answer is going to really be contextual. But here are the things that I was able to get feedback from the infection control people. Like, what is the concern? What are the concerns? One of the major things that I heard was that the infection control people are concerned about residents getting into the PPE. Okay. And this may be of a special concern if you have residents who have dementia, who tend to go through things, right? And so where you put PPE for some residents may be different than where you put PPE for other residents based on their needs. So if you put PPE in a room, they're really clear. Once that PPE goes into a storage space in that room, it can't come out for anybody else. All right. If the PPE is stored outside of the room, however, you got to be able to get to it quickly and easily, and surveyors need to be able to see you do that. But how far is too far away? There's no definition for that. So I don't have an answer for you on that one. So let's talk about what some of the considerations might be. So in the hallway PPE storage, we have heard that carts will be permissible in the hallways. That comes with a caveat, okay? Your hallways are also where emergency responding services, they come rushing down those hallways if they need to address emergencies. They don't want to have to work around your carts, okay? So you need to think about how many carts are we really talking about? Because if you have carts in the hallways, you may also need to be prepared to have an emergency response plan that relocates a cart if the fire alarm is pulled. So if you end up with, let's say you actually do have 50% of your residents who have EBP protocols, and you're using the hallways as the primary storage in carts, that could end up being a lot of carts in your hallway. That also means that your residents may not have easy access to handrails that they need to stay as independent as possible in their own hallways. And so lining the hallway with carts might not be the best uniform answer. It may need to be a combination of things, okay? And so this is just a quick little schematic of, okay, what might that mean if we had 50%, we said, okay, 3 carts, okay, 5 carts, couple carts up here. That's a lot to navigate around, okay? So I just will caution you to not just to default to the notion of we'll just put carts in the hallway, because it may trigger some other actions and time-consuming resources that you didn't anticipate. So here are some things that are being tried. These are actual peak homes that have done some approaches to in the storage of PPE. This one, they've put these small, these carts actually are not on wheels. In fact, that's usually one of the things the fire marshal is going to be concerned about. If you have a big cart that encroaches on the hallway, they're going to want to know that it can be moved quickly. And so if you have a very big cart, I guarantee it's going to have to be on wheels. The jury is still out. I have not heard how this has been received from surveyors and or the fire marshal, that it's being tried. Okay, yes.
One of them, that's actually my home, and it was fine
Great.
with both.
Excellent. Excellent. Because we're learning together, folks. We're going to work our way through this together. Notice that they've done a similar thing. They've actually made a little yellow sticker there on the door. Okay, it does say EBP, but it's a lot less obtrusive than that big orange sign, right? So again, you know, little approaches that are being attempted. Now, here's one. The trash can here is actually outside the room. According to the information that's online with CDC, they are indicating they want to see the trash can inside the room so that the PPE comes off before staff go back out into the hallway. Okay, so again, we'll see. We'll see how that is received. Hand sanding and putting more of that alcohol-based rub more accessible. I think we've pretty much kind of gotten used to seeing hand pumps pretty much everywhere. I know that I've heard a lot of infection control people who've said we want it both inside the room and outside the room. They would really like to see a lot of access to that. So these carts here, like I said, they are less bulky and obtrusive on the hallway. Now, they do, however, get the storage pretty close to the floor. There's going to be a lot of bending, stooping involved in that. So this may also be something you want to think through with regard to your staff, with regard to range of motion and what they're reaching for. And then the other thing that has yet to be tested, what if a resident comes by and wants to open the drawer and look at what's in the drawer outside of someone else's room? Do we have cross-contamination concerns that crop up later as we put some of these practices into use? To be determined. Okay, so trash. According to the frequently asked questions, we are not needing to put this in medical waste. We don't have to double bag it, don't have to red bag it. It can go into the regular trash receptacles. Again, we do need to consider that they are looking for the removal of PPE inside the room. So you might want to look carefully at the room layout and decide where that is best placed. So here are, again, some considerations. Let's say you determine that a bunch of stuff in the hallway isn't the right choice and you document one. And you say, we are going to put PPE in the room and we will restock it as needed because we know we can't bring it out of the room and use it for anything else. And the residents who live in this room, we're not worried about them rummaging. Okay, maybe you have a series of decision-making points. I looked up over the door because let's face it, storage is usually a premium. There's usually not a whole bunch extra in any room, especially not a shared room. But maybe an over-the-door storage caddy might serve that purpose. I found one on Amazon. It holds 44 pounds. It's heavy duty, load capacity. If you are out of other options for accessible storage in a residence room, that might be a reasonable alternative. You may want to take a look at any existing storage in a residence room. Ask yourself, okay, how is it organized? Is there any opportunity to reserve a spot that's just for PPE for that resident? And some of that storage may have the capacity to be secure. So if you've got a resident who's likely to get into stuff, maybe that little spot could have a quick padlock on it or like a code on it, or maybe a key that you keep around your wrist for that resident only. And maybe there's some existing spaces in the room or a cabinet that can be added that don't take up, again, needed space for ambulation. You also want to take a close look at accessibility. If you have a resident who's using a wheelchair, you don't want to clutter their bathroom so much that they can't ambulate into their own resident and be able to function to their best ability. You also want to think carefully, if you don't already have hand sanis placed strategically on the inside of a residence door, take a look at where those locations might be easy for staff to develop a habit that intuitively when they walk in, they use a hand sani, and intuitively when they walk out, it's right there. They don't have to go looking for it. Okay. And so that, again, takes some problem solving as a team. Okay. The other thing that you're going to want to look for is, okay, where within the room do we want to place the trash receptacle so that if PPE needs to come off, it quickly goes in a waste can. So one of the things that I want you to recognize is that the peak domains and cores can actually help you problem solve through this. Okay. So the first thing, if you look at the core of relationships, we have the domain of getting small. And that domain already encourages you to have necessary supplies and equipment available in each work area. You're already doing some of this. Okay, so if you have already thought through, okay, how do we make sure that staff have what they need where they need it? Apply those same, critical thinking skills and assess, okay, do we make a couple of adjustments with storage here and there so that we get the PPE closer to the residents who need it so that it becomes easy for staff at the point at which they need to deliver that sort of care that requires PPE, that it's not a headache to go, two hallways over. Consistent staffing. You already know that. The goal here is to build relationships with residents and to have staff who have some versatility in their capacity and training. And so use that to your best advantage when you think about how a team member begins to understand the needs of residents who have EBP protocols so that they're more strategic about the interactions that would require them to get all donned up versus those interactions that don't require the extra PPE. And developing versatility with regard to if someone has already had to don up, is there anything else that they can do that requires that sort of PPE they can do right in the moment, as opposed to having another staff person come in 5 minutes later, putting PPE on to do another activity that basically requires the same effort. So again, that just takes some back and forth problem solving. And ultimately, action planning. That's what we're talking about here, is using your peak action planning strategies to make that decision-making tree, because it really is going to make a difference. Some of the homes that provided examples, they only had 4 or 5 residents out of 60. Okay, that's a relatively small percentage. So their answers to approaching where that storage is at, it made a big difference with regard to how much and the location, because fewer residents. Okay, if you have a home that has a lot of residents who are subject to these protocols, you're going to have different decisions to make. Okay. Ultimately, I do want to stress here, this is new. And I think one of the reasons that it was difficult for me to get exact answers, even from the infection control people, is that we don't fully know yet what some of the implications for all of this are going to mean, and some of the potential headaches that you're going to experience trying to implement these protocols on a daily basis, that they're going to need to learn from you. Okay, so it's going to be helpful if we all think about this as a collective effort to document what's going on. What are the expenditures, right? How is this impacting your supply, your purchase, your staff hours? Think about also how you can kind of track, are residents being less subjected to infections? Do you see a change? Do you see no change? I think the infection control people need to, they would value that sort of information because there are going to be some things I think we're going to learn along the way that are going to help this evolve, and hopefully we can evolve towards more person-centered approaches, because I know this is a big concern to a lot of people, including residents who are looking at people coming in to their rooms, with lots of garb on, right? And, to say that that doesn't make a difference on someone's psyche is to be, I think, a little, but we also can't deny that if the infection control people are telling us that these superbugs are something we need to worry about, we don't need another COVID, right? We don't need another situation like that either. So with that, I think having maybe some Q&A, some talk time. Anything's fair game here. Yeah,
Showing two semi-private rooms, talking about not exiting the room. Are surveyors being particular, or does anyone know
yes, they may know.
your building? If bed B or the bed next to the window had EVP in bed A is not, do they expect you to take off, or even if they both do they expect you to take everything off on that side of the room?
Oh, before you go to the
Before
other
you
side.
walk through the other side of the room to exit, because it's technically a different.
Right. That I don't know. I didn't have that situation. I've not had that.
So the question was, we'll just pass that around. The question was, if you have two residents in a double occupancy room. Let's say the resident closest to the window has EVP protocols, the resident closest to the bathroom doesn't. Do we have any experiences yet with surveyors stating expectations about, say, where the trash can's located? At what point you take off the EVP? Can you do that out the door? Do you have to do that before you get to the divider curtain? Anybody have any experiences?
We just have our trash cans are all on this side. The trash cans are on the side of the person that needs the EVP.
Okay,
And we did not have any issues survey-wise.
that was a good question. Other questions? Yes. Okay, we're recording it that way. It'll be louder.
No, I was just curious on that first slide or so where it's the CDC warning sheet. At the top, it says everyone must, and then below that, it says staff, I believe, and something else are required to do further, but it sounds like everyone must. Who is everyone? Is that visitors? Is that family? Is that, yeah, but that one there.
Okay, so my understanding, get to this.
I'm just curious with your butterfly flower, how does that tell everyone must clean their hands, including?
Okay, so the first thing is that because this is an isolation, it is interactions that have to do with the transmission of body fluids, all right? So I would say that I have not heard from any of my contacts with the CDC that they're expecting family members to go in and put on PPE if they are going to be interacting with their family member. That's a good question.
But to elaborate, are we trying to warn, to notify visitors that they should wash their hands?
That's another very good question. The question was, do we need to be warning visitors to wash their hands? I would suggest that because the sign obviously should mean something, when I had the note here, effectively communicate with residents about the policy, that probably should be expanded to family. If you're gonna, again, articulate the protocols that you are putting in place to create more safety and infection control, that probably would not be a bad idea. But the notion of other people who have to don PPE, has anybody had an experience with a surveyor that has said, yeah, if a family member goes in and they're gonna do this, we expect to see? I mean, but it's a legitimate question. I guess I would say if a family member was gonna go assist their loved one to the toilet, you know, I don't know what a surveyor would say to that. But because the EVP, they're clear, you don't have to put PPE on just to enter the room. It is for those interactions that create the body fluid transmission risk, that the everybody must thing, it's if you're gonna do this, you must. That would be my best interpretation. Yes.
When we had a COVID exposure at the building, we had some families that refused to gown up when they went into a residence room. So what we did is we did the risk versus benefits, plus we did put it in their care plan and had it documented all over the chart. So surveyors did come in it was a tool to show that we at least did that education. And we were okay with that, but we gotta cover those bases
Yeah.
is what's going through my head right now, but.
Mhm. Yeah, because I mean, again, the surveyors probably appreciate that you can't control family. You can have some control over your staff because they're employed. So, I would say that, you know, the documentation piece there is probably really smart. That you did your due diligence. And again, the notion here is, you know, I'm a little, curious, why these same protocols aren't being implemented in hospitals. It's just in nursing homes right now.
They're already in place.
Okay, well, that's contradictory to some information that I've seen online. So these additional enhanced barrier precautions, right now, they're stating that they're only being rolled out in nursing homes.
They're not called EBPs
Mhm.
in hospitals, but hospitals are enforcing infection control for big bugs. They have been for years. So
Okay.
this isn't a new thing this is going an extra step, I would say.
Yeah.
But, yeah, because as a family, we've had to fight
Mhm.
on, we weren't providing any care, but they were wanting us down in gloves and legal and mask and stuff. So, it's just different in the hospital.
So with regard to like regulating it, I guess that's where I would say this is still kind of in motion. And I think we're gonna see how surveyors respond to the protocols and actions. And I guess my best advice is that your best approach is to have a logic tree of why you did what you did based on how many residents are you dealing with? What resources do you have? What can your building facilitate easily and cost effectively? And if you keep track of those sorts of expenditures, because one of the things that I've also seen is that they are acknowledging that this may save money for hospital stays, but you're not going to see that savings as a provider. You're going to pay for more PPE, but further up the system, it's supposed to save money. But I think we've got to help the system understand how to rebalance that resource demand and those costs. And the only way we'll do that is if we are players in providing helpful feedback about how the policies can be implemented in ways that are workforce friendly and also respect the infection control and safety objectives that are at play here. Other questions, other ideas? This is good. Yes.
Do we have any concerns about making those magnets smaller, making the PPE storage areas smaller, that compliance is gonna be harder? There's fewer reminders for employees.
Yeah. So no, we don't have any research because this is so
That's
new.
fair.
But what I would point to is that two things. The, oops, I'm going the wrong way. The home that implemented. Oops, there it is right there. See that? That is no wider than that door frame. Okay,
Pretty.
yeah. Door frames are about 2 to 2.5 inches. Okay, and that's what they did right there. It's fitting right on that door frame. And so, you know, that's why I'm like, and you see right here, yeah, it's pretty small. Okay. The idea, however, is communication and training. I would say that's the more important thing. The surveyor walks in and says, hey, I don't see any, you know, EBP signs. Your staff can say, oh, yes, there are. They're right there. And that means that. The other homes that have provided examples, that's the route they've gone. And I've not heard that they have been cited. Other questions? Yes.
I just had an idea for the magnet, so I think no matter how often we train and remind our staff members or even myself, being able to see the documentation of the warning sign and what it includes, so you could even put like a small QR code on there so they could take a picture of it with their phone and it would go straight to the form and pull it up.
That's a great strategy. Those are types of problem-solving approaches that I think you need to think about. What are the resources we have, right? And what would work for our staff?
Right, and it would cut down on expenses as far as printing all of the paper,
Yes,
but it could go, you could even do education for families that way as well.
exactly. A QR code, using technology. I think that is brilliant. Absolutely. And it's discreet, right?
Yeah, you
Um,
could just add it to your magnet.
mhm,
It wouldn't have to be anything.
you could.
Sign on the front door that said, if you see this, please try to access.
Yeah, and so that way you scan it and the information you need comes right up. I love that. The notion of embedding information that's retrievable almost instantaneously. I think that would be a great approach. Yeah. How many of you feel like you've got enough hallway space to discreetly stash PPE close to enough rooms? A few of you? Okay, that's good. Okay. A number of the homes that, in a lot of homes, and I know some of our older homes, that's not always a luxury, right? And even some of the newer homes that might have some niches, having a bunch of carts in those niches where you'd prefer to have a couple of chairs so residents can, come down the hallway, take a rest, and then keep going would be a preferable use of that niche. I get it. But I just want you to also recognize that putting a bunch of stuff in the hallway, while we have heard carts will be permissible in the hallway, I just want you to recognize that your fire marshal may come in and say, in the event that the fire alarm gets pulled, I need to know that somebody on the shift is assigned to move that cart out of my path of travel. And so I don't want to be surprised by, oh, but they said carts were okay, that there aren't some potential consequences of that. And the other one is just thinking about how much space of handrail gets consumed or impeded by trash cans and carts, because those handrails are there for the residents, so that they maintain as much independence and autonomy that they can to get from their room to the social spaces. So I just want us to make sure that we're always, balancing the trade-offs in our decisions. And it won't be that you won't have to make some decisions that have some, like, gosh, I wish we didn't have to do this, but it's the best of all the choices we have. Other question? Yes.
There's something that could substitute the plastic doors or something, like a wall organization, like vinyl.
Yeah, maybe. Absolutely. And this
Still leave access to railing.
So something, and again, here's where I always defer to the fire marshal. Anything that's affixed to the wall, there will be limits on how far it can protrude out from the wall, because of detectable warning requirements. And also, if the PPE contributes to combustion. Right? So if it's affixed to the wall, there may be concerns about that. But that's why I had looked at like that over the door.
I've seen that in facilities, but on the outside.
Right.
Facing it to the hallway. But
Right. And again, then you want to think about how does that look on our hallways? Yeah. And it's kind of the difference between, well, it's not in the room and they didn't want it in the room. But so this is what I'm talking about. You're going to have a series of, we can do it this way. Here's what we get. Here's what we give up. And the goal is to try to come up with a solution that has more positives than negatives. But yeah, that I think those are creative approaches, thinking about where else can it be, and how much PPE do you need right there, and do you implement a restocking system, right? Do you have a system where you don't try to keep a whole bunch of it? You say, okay, on a regular basis, this is how often that gets restocked, only for that resident. That way the storage can be discreet and small, and we don't have to worry about wasting storage or PPE if in a room. If someone else needs it, I'm not worried that I've overstocked one room and now I can't use it for anybody else. Yeah. Other questions? Okay, I hope this was somewhat helpful. I wish I had more exact magic bullets for this. But all I can say is this is new for a lot of folks and we're gonna need to navigate this together. So if you do come up with some creative strategies, do share your ideas. Because this is gonna be something that I think we'll collectively be able to address as a community of person-centered care providers much more effectively. So, okay, thank you so much. I appreciate your time.